Okay. Hi, my name is Yara Khalifa. I am a fourth year medical student at Nova Southeastern University. And my presentation is Intussusception secondary to heterotopic pancreas. So heterotopic pancreas, or HP, is just basically when you have a pancreas that is functional or non-functional, that is in a accessory or an area that is not where pancreas is usually found, and it can be found anywhere in the GI tract. And so it's actually a rare embryological deformity when there is essentially pancreatic cells that are misplaced, and they continue to grow into adulthood. And while it is lacking vascular and anatomic connection to the main pancreas, it could still secrete either exocrine or endocrine hormones as well. And there's two theories for this proposed mechanism. The first one I mentioned, which is that basically when there is the embryological sort of 270-degree turn of the GI tract to make the small and large intestine. Essentially, a part of the pancreas is left behind. And another theory is that basically cells just migrate into a accessory area. This is very, very rare and is usually not even on a differential list. It's usually found post-mortem or during exploratory surgery for another illness. And so I presented this case, 27-year-old male, who presented basically with classic signs of intussusception. He had intermittent sharp pain in his lower abdominal area for a couple of months, actually, and he was not able to come in due to lack of insurance. Once he was able to get insurance, he came and we did a CT abdomen and pelvis without contrast, and basically were found to see the target lesion. So we knew it was an intussusception, but we didn't know what it was. And once we were actually able to go in and do an X-lab, we then found that once we took out the bowel and actually cut up the bowel, then we found ulcerated sort of fatty mass, and we were confused. We didn't know what it was. So once histology came and did a fresh frozen sort of section of the mass, she came back, she told us that it was actually a fully developed pancreas, but it was ulcerated and non-functional. And so I just found that this case report was very unique because, first of all, this is not something you see in a live patient to begin with. And there is no sort of history or anything that would point towards this. So it was purely an incidental finding. And so I just found that to conclude that this was a very interesting case. It's usually asymptomatic, but can cause issues if it is like you see an intussusception or cause other another illness. Yeah, it was a very unique case, and thank you for allowing me to present this.